Good day. My name is Imelda Williams, and I'm going to give you an introduction to the iSAP case for this unit. And the iSAP case is concerned with a cervical spine in a patient with acute neck pain after falling off a push bike. Monash University recognizes that its Australian campuses are located on the unceded lands of the people of the Kulin Nations and pays its respects to their elders past and present. iSAP stands for Integrating Science and Practice, and the main reason why we have an iSAP case is to make sure that you have those critical thinking skills on when you view images of the cervical spine. The overall weighting for the iSAP case is 30%, and the word count is 2,000. There's two parts to the iSAP case. The first part is a clinical action plan, and that is the biggest part of the iSAP case. The word count for that is 1,500 words, and the comparative report is 500 words. Now, the university has a leeway of 10%, which means you can have 10% less or 10% more. However, do not go over those leeways. Now, this iSAP case is not a competency hurdle, but as you can see, the weighting is quite big. It makes up 30%. So you need to ensure that you do your absolute best with this case. You will find all of the information about the iSAP case under week 2. There is a dedicated Moodle book for that, which will have the learning outcomes. It will give you the scenario of the case and then also which professional issues must be addressed. There's some limited resources provided, but you also need to add your references. And then just in regard to references, you can use either Harvard or Vancouver. However, you can't use both in the same document. This is just a snapshot of what the iSAP case looks like on the Moodle site. So here's the learning outcomes, and then on the drop-down menu, you will have the case scenario. You can see there's 3 parts to this case, and then the professional issues that needs to be addressed, as well as the resources. You can also download the marking rubric, and that I would encourage you to look at it because it will give you an idea of how we actually assess your report, and then also you can submit your report directly here, but also under the assessment tab as well. So it's much more easier to just submit it on the assessment tab. And then there's a link to the expert report, which will not become available if you have not submitted your CAP report, and then you will submit the comparative report and so on. So this is the rubric that we use for marking. So the first thing that we look at, how did you address the professional issues? And you can see where the best marks will be achieved when there's a very strong and critical discussion of the issues and with the necessary detail and a critical application as well. And then looking at the quality of the action plan. So how well you've applied the plan, and will the plan that you've applied, does it actually produce appropriate results? And then we're looking at supporting documentation. So have you added to the resources? Have you utilized it correctly? Has your references correctly as well? And then also there's key references that you need to consider. And then for the comparative report, so making links, so comparing and contrasting the CAP reports with that of the experts report. So we're looking at this logical evaluation that you have, and also how you're going to apply that to your clinical practice. For the comparative report, you don't need references because you're doing a comparison, but if you feel, and students sometimes do actually use references as well to support their ideas. So for this assessment, the deadline for the clinical action plan is the 4th of April, and the deadline is at 5 to 12 in the evening. And there is a dedicated assignment Dropbox under the assessment taskbar. Once you have submitted your CAP and when the deadline has been reached, which means by the by the 4th of April, the end of the 4th of April, the expert report will become available then. And then a week later, you need to submit the comparative report. And this is what it looks like on the under the assessment taskbar. So there you can see there's a Dropbox for the CAP report, there's a Dropbox for the CR report, and then also the expert report. You can see with the expert report, it will not become available unless you have submitted your CAP report, and if it's only if it's on or after the 5th of April. And then with the comparative report, will also only be able to submit that if you have submitted your CAP report. So then with the comparative report, when you get the expert report, you need to compare and contrast your CAP report to that of the expert report, and then address your comparison in a logical manner. You can even use bullet points for that as well. So you need to compare what are your strengths, your similarities, and also any differences. And then think of the learning outcomes that you have achieved through this iSAP case, and then what will the impact of this knowledge here on your clinical practice. So not everybody in the course are radiographers, so apply it to your professional practice. So in conclusion then, make sure that you review the iSAP Moodle book carefully, which you will find under week 2, and then ensure that you do apply the clinical professional, but also the radiographic knowledge. Even if you are not radiographers, you need to see that for this case from the radiographer's perspective. And then we've given you some starter references, but you also need to add additional references. So I wish you all the best with this iSAP case. However, if you have any issues and any queries, please feel free to contact either myself or Tony.